Many of you will head home for the holidays. As you gather with family, you'll catch up on a lot of things. Our next guest hopes one conversation you'll have is about heart health. Dr. Elizabeth Ofili is a professor at Morehouse School of Medicine and specializes in preventive cardiology. Good morning, doctor.
Thank you so much for having me, Mary. Appreciate it.
It's our pleasure, and this is something that's very close to my heart. I think about heart failure for a lot of folks. It's a misnomer. What is it exactly, and what are the symptoms and signs?
Thank you. The thing to remember about heart failure is that while it says failure, it's not that your heart is stopping or that it's totally destroyed. It is actually an opportunity to recognize that there are some symptoms that have developed gradually over time. Sometimes it's weeks, sometimes it's months, but paying attention to things like shortness of breath, fatigue, really having to rest in between the usual housework that you were normally able to complete or any of your daily activities. And then as well experiencing some swelling of your ankles, so around the abdomen with weight gain. Think about these symptoms as possible warning signs about heart failure, especially if you have some risk factors that we'll talk about.
Who is affected most, or if you think about who's at highest risk, who's in that category?
So individuals that we consider to be at highest risk are individuals that have certain risk factors. First of all, it's important to recognize that anyone at any age, man, woman, all race ethnicities are impacted. We also know that African Americans have significant disparities with heart failure. And indeed, if you have high blood pressure, diabetes, smoke cigarettes, or have suffered one or more heart attacks, you are at risk for developing heart failure. And an opportunity for awareness during this holiday season is important, and that's why I partnered with Arbor Pharmaceuticals to bring this message out to the community.
Are there treatment options for heart failure if our viewers are gathering around the table and talking to the people they care about most about their concerns, and then to advance that conversation toward treatment? What is available?
Yes, very good. There are good treatment options now that actually help individuals have a very good quality of life and prevent hospitalizations and improve survival. One of the things that are out there is we have drugs known as ACE inhibitors, beta blockers. We also have a drug called a fixed dose combination of isosorbide dinitrate and hydralazine, which when used with standard therapy really results for African Americans much better outcomes for heart failure. We have found better quality of life, improved survival, and reduced hospitalization. Of course, with any of these therapies that I mentioned, it's important to talk to your physician or provider to be sure about what's the best therapy for you.
And do you introduce those therapies, let's say, after you've already had a heart attack, or to some extent, is it about preventing a heart event?
So they're actually both ways. So we know that if you have hypertension, diabetes, some of the risk factors I mentioned, heart attack, doing the preventive measures in terms of lifestyle, physical activity, watching the sodium or salt in your diet is critical. But once you have those symptoms and the diagnosis of heart failure is made, then the drugs that I discussed need to be started, obviously in consultation with your physician. And again, the opportunity around the holidays to talk about these various signs and symptoms and find out who needs to be screened and provide early opportunity for diagnosis, because then we would have really good outcomes.
Well, Dr. Ofili, we appreciate you joining us today, and a Merry Christmas to you and yours.
Merry Christmas to you as well, Mary, and thank you so much for having me.
It's our pleasure.